Hello, welcome to our insightful moment for today. Thanks for giving us your time and your attention. We are looking at the issue of clinical officers moving to UK to work as physician assistants. In UK, they call them physician associates. In the US, they are called physician assistants. So this video is going to look at the process that a Kenyan is going to follow to work as a physician associate. So who is a physician associate? A physician associate is like a clinical officer in our current setting. This is they offer diagnosis, they do patient management, and they prescribe. But the thing that happens in UK is that when they prescribe, they normally do the prescription online. A GP will have to approve the prescription. So it is just like the clinical officer in our setting in Kenya. So they are junior doctors, they offer patient management and they offer patient care. It's a very young career in the UK medical system. So this is how they did it. So when they were introducing the system, like I would say like 5 years ago, what they did is that they allowed students who had done bachelor's degree in life sciences to do an MSc in physician associate. So this is be a person with BSc biochemistry, BSc biomedical sciences, BSc medical laboratory, BSc zoology, BSc, which other life science have I left? Yeah, those are the BSc biotechnology. Yes, BSc biotechnology. So these are the common life sciences that are offered by universities. So what they did, they took these students and they gave them an opportunity to do a master's degree, a 2 years intense program. We have about 5 years in the UK which were offering that program, and this was done for about 3 years. Then 2 years, not after the 3 years, they now introduced a bachelor's degree in that course. So now we have people studying in the UK 4 years to do physician associate. Now, last year, good news, they decided now to take international students of people who have been trained in foreign countries, just like the way they absorb doctors from other foreign countries. So that has been the genesis of it. And then last year, December 2024, is when they gave us the requirements and the protocols and the procedures for a clinical officer to work in UK. Okay, so what are the requirements? The first thing that you need to do as a clinical officer trained in Kenya is to make a request through the GMC website. So you apply to the GMC and you let them know that you are interested in relocating to the UK as a physician associate. They will ask you for several documents. They will ask you for your academic transcripts. They will ask you for your certificates, all these police records and what have you. Then the things that they are looking at is that how many hours did you study and for how many years, and which institution do you study. They require that the institution that you did your clinical medicine in Kenya should be recognized in our own country. So you cannot go to study clinical medicine in an organization that is not recognized in Kenya. So most of the people have studied in KMTC or they have studied in universities and those ones are recognized. They require that your program must have taken a minimum of 2 years. This means that those who have done a diploma and also those who have done a degree, they do qualify to get that opportunity. And then they require that your total credit hours should be more than 3,200. So you see, like the way the doctors, they require that you should have had a total of credit hours more than 5,000. This is what they will require for clinical officers. And this is where we have some challenges because our program with KMTC, when you count the total hours of interaction, they do not click 3,200. But when you look at the bachelor's degree, those who have done a bachelor's degree in clinical medicine, they hit the 3,200 mark. And then they are also looking at your rotation. You should have done rotation in internal medicine. You should have done rotations in mental health. You should have done all the rotations in a hospital. You should not have just trained in one area. So that is what they do. And then when they assess your qualifications, they give you a positive report and they tell you that you can go ahead. If you did a diploma from the KMTC, I know they'll have issues with your total clock hours, and there is a way to go about it, just the way when doctors don't hit the 5,000 clock hours, especially those doctors who study in Ukraine and in China, these countries that train doctors for 4 years. There is a way we navigate it and we communicate with GMC, and at the end of the day, they are able to give you an admission. Then after that, you're going to verify your academic documents. There is an organization called ECFMG. It is an organization that verifies academic documents for physician assistants and physician associates. Now, I'm just comparing apples and apples, apples and mangoes. So there we have WES, qualifying academic documents for university students who want maybe to do PR, or the way you see HCAS, verified documents for medical doctors. ECFMG is the organization that verifies academic documents for physician associates or clinical officers. So what this means is that they are looking to ensure that your document is not manufactured in Liverpool. So you're going to submit your documents, you pay the assessment fee. If you studied at KMTC, they are going to contact KMTC. If you studied in a university, they are going to follow up with the university to ensure that your documents are legit and your documents are genuine. After that, you will sit for the IELTS exam. This is the exam that it's the English proficiency exam. It's the exam that is saying that you understand English. It's going to look at listening part, writing part, reading. And what you need to know is that the thing that really disturbs us as Kenyans is the writing part. You really need to put a lot of effort, and we do have coaching and mentorship sessions that we offer our candidates who are sitting for the IELTS exams. Now, after you have verified your documents and after you finished your IELTS exams, you are going to communicate to the GMC, and the GMC is going to set you up with the Royal College of Physicians. At this stage, now you are ready to sit for the exams that will prove that you understand clinical medicine, or you've qualified to work as a clinical officer in Kenya, and you can work as a physician associate in UK. So it is a GMC, you communicate with the GMC will set up, will introduce you to the Royal College of Physicians. So you pay the fees to the Royal College of Physicians, but you cannot pay the fees without getting the identification number from the GMC. The number is usually a 7-letter digit, starts with an A. So the exam is in 2 parts. There is a knowledge-based exam. The knowledge-based exam is an MCQ. 200 questions and MCQs are easy stuff, yeah. It is administered by the Royal College of Physicians, and it is usually an online exam. So they'll give you a date and a time, and there is a specific app that they use for the online exam just to reduce cases of cheating. When you pass the knowledge-based exam, then you are ready for the next step, which is the clinical exam. It's called the Objective Structural Clinical Exam, the OSCE. They are looking at your understanding of your actual clinical practice, and this one is normally done in the UK. It is normally a 14-station exam. So you sit in one station, you ask questions, then you go to the next station, you ask questions, something like that. Now, when you have passed your exams, you will go to the body that is regulating clinical officers in Kenya, the Association of the Clinical Officers, and they are going to give you a certificate of good standing. The certificate of good standing is going to prove that you are a person of good conduct and you are maintaining the ethics of medicine here in Kenya. Then after that, now you're going to communicate back to the GMC. The GMC will have already sent you the email, because when you pass your exams, the Royal College of Physicians will communicate to the GMC to let them know that you have passed the exam. Then after that, we are going to register you. And after that, registering you, then there is a particular association for not clinical officers, for this physician associates that you're going to register, because you cannot get a number if you're not in the association for the physician associates. Then after that, good to go. You're good to look for a job. It's easy to get a job as a physician associate. Actually, we have a very high demand. That is why in December 2024, they opened up these avenue. So I would encourage anyone who has studied a bachelor's degree in clinical medicine, or you did a diploma in clinical medicine, but you've got a lot of years in clinical practice, and maybe you have participated in a particular research, or your name has been written somewhere, meaning that it can compensate for the clock hours to pursue this route. We are ready, we are available for any consultation, any question that you may be having, just hit us up. Our email is in the description box. And thanks you for your time. Thank you for your attention. Thanks for watching to the end. Consider subscribing if you're not a member of this big family. And it's a goodbye for now. Bye.